All right, welcome everybody to the COVID-19 town hall hosted by Plan Companies. With us, our special guest, Martin Calabar of the legal firm Becker and Plyakoff. This meeting will be recorded and will be made available on our website to all of today's attendees. After a brief overview, we'll have a question and answer session with our panel. If you look at the bottom of your screen, you'll see the Q&A button on your Zoom controls. From there, you can type your question. Today's panel includes Rob Francis, President and CEO of Plan Companies, Dino Iuliano, Chief Revenue Officer, Astrid Garana, Chief Operating Officer, and our special guest is Martin Calabar. Martin is an attorney with the firm Becker and Plyakoff. He specializes in real estate with a focus on community associations as general counsel and in complex commercial litigations. To present our agenda, I'd like to turn it over to Plan's Chief Revenue Officer, Dino Iuliano. Dino?
Thanks, Nick, and welcome everyone to our town hall presentation today. We're very excited to be bringing this to you, and we had an overwhelming response to the folks who wanted to join us, so we really appreciate that. We're going to keep this as informative as we can, and from earlier questions that we received and what we want to do perhaps going forward. So we're going to go through a brief presentation because, as I mentioned, this is a town hall. We're all here because we know you have questions and we want to get them answered for you. So please continue through the Q&A at the bottom of our screen as we go through some brief slides and keep filling in the questions here. So today's quick overview, we're going to talk about Rob Francis, our CEO, is going to talk about effective communication and staffing challenges. In fact, some of the questions we're already seeing have to do with that. Astrid Garana, our COO, is going to talk about plan strategy. What are we doing specifically? Maybe give some good ideas that you hadn't thought about and share some best practices that we're seeing in use at some of our properties today. Of course, our special guest, Martin Calabar, is going to get into legal and insurance questions. On some of the calls that I've been fortunate enough to do with Martin, these questions come up a lot. I'm going to talk about safety and security, what you should be thinking about in those areas now. And then, of course, we're going to leave you with some resources, areas that you can go to answer some other questions you may have. We're going to get to as many questions. We allotted for a half an hour. We're going to go well over that if needed. Sure. But we're here for you, and we'll stay here, and we'll get your questions answered. If not, during our presentation today, we'll take the questions away, answer them, and get them out to the group after today's presentation. So with that said, I'd like to get us started on effective communication and staffing challenges with our CEO at Plan, Rob Francis.
So thank you, Dino, and thank you all for taking the time to participate today. First and foremost, and I know many of you, when I'm looking at the participant list, I hope all of you and your families are healthy and safe, and that you're taking the steps to remain healthy and safe. This is a time where, regardless of your title, your company, what you're doing in the industry, we really are all in this together. Out in the world, there's great uncertainty and anxiety with news stories coming in by the moment. I hope a meeting like today brings some clarity on some topics and more closeness, especially for those of you who know me. Social distancing is very unique to me and tough, and I'm sure it's hard for many. So again, we're all doing this together. During this time, you really can't communicate enough with your teams, your colleagues, your clients, and your employees, or your families for that matter. Zoom, what we're doing today, are webinars, virtual meetings, virtual touch points. This is pretty much our new normal for the short term and likely for the long term. Some suggestions that we've been employing that you might be using as well as, and I wish we were doing video, a weekly video meeting or chat with your teams, because you want that, the human touch and emotional connection. Set your webinars or your phone conferences or your virtual touch points with the content kind of planned out. These circumstances certainly call for planning and being more methodical, and you'll hear about contingency plans, staffing plans, remote networking plans or work plans. So as information is constantly flowing in on COVID-19, we're getting new statistics, new developments, updates on supplies and equipment, new treatment centers, and more. All are being communicated, in real time. So having these kind of virtual touch points are huge. At Planned, as you can see, we've established a COVID-19 section of our website really for the industry, on CDC guidelines, on products that we're using, on alerts and updates that, from what the feedback that I'm getting, many have found useful in the industry. We've established an employee section to address employee assistance items, provide additional contacts and resources, and provide and promote information on our employee relief fund. And we've established, fortunately, a number of years ago, an internal communication system, which is really based on texting for SMS communication, best way for us to reach over 4,000 team members in 10 states, to give them links on safety, here links on the virus information. I certainly suggest and think that texting is a very effective means of reaching your audience. So these are three areas or items that we've used to effectively communicate during this time. So next slide real quick. On challenges. So we're all pretty much facing the same challenges regardless of our specific industry. Informing and motivating our troops, right? Believe me, I think for the most of us, we're seeing the heart and character of our workforces. They're the ones going in the line of fire, selflessly working at properties and communities throughout. I'm going from the lens or perspective of janitors and maintenance and security and concierge, for management or legal or insurance, for all the trades, men and women from our companies are going in and performing every day, and it's amazing. So we have to continue to motivate and inform and inspire and empower our groups to continue to do so. And by the way, as you know, the challenge presents both personal and professional obligations for our teams, whether it's childcare, caring for parents or grandparents, feeling ill and taking the precautionary steps of self-quarantining or being self-quarantined, being sensitive and present, even virtually, is important. Procuring the right supplies and equipment and personal protective gear and more, not just weeks ago, but today. We all want more masks, more gloves, more sanitizer, more personal protective equipment. I saw questions come in about it. We get asked about it all the time, more disinfectants, and we're rightfully competing and should be competing and with hospitals and care facilities that absolutely must obtain it. And then so do we, in active adults, assisted living, in our condos, in our HOAs, in all our properties. We are striving and getting more of these resources in. Handling properties and communities where sadly our residents or our tenants or our team members have contracted the virus or are feeling ill. The most important here, again, back to my initial message, is communication. Communicating with the client communicating hopefully back to us as service providers, having those individuals impacted with the right information, quarantined, tested, having those who've had contact with those individuals alerted and taking the right steps, having those areas frequented by those individuals disinfected and attended to, having contingency plans in place to ensure proper staffing, having protocols established on visitors and guests and contractors like us and others who may wish to gain access to the property or community. All very important challenges, and really the list can go on and on and on, and I'm sure we'll talk about it during the Q&A. So again, regardless of the industry, we're all in this together. I thank you for the brief time and that everyone jumped on. I'm going to turn to Astrid Garana, our COO at Planned, who has been instrumental in working with our team literally by the hour to face this challenging time. So Astrid, to you.
Yeah, thank you very much, Robert. Good afternoon, everyone. It is my pleasure and privilege to be on this panel today. I hope that you find great value in what we are presenting, and feel free to note any questions and ask at the end of the presentation. While there is much we can touch on, I wanted to briefly discuss three topics: preventive cleaning, cleaning in a building that has, excuse me, a confirmed case of COVID-19 and disinfecting products in proper use. So, preventive cleaning. It is important to shift the focus to continuously disinfecting all of the touch points. With properties closing their gyms and amenity spaces, we are shifting the labor to increase the frequency of cleaning high-touch surfaces. Staggering the shifts is also important, which means a property that had the cleaning done between 8 a.m. and 5 p.m., let's say, with multiple associates, we're starting earlier and finishing later in the evening, so there is a longer period of coverage. It is important that the front desk team is also provided with disinfectant products, and they can keep their immediate area clean and be safe. If there is a confirmed case in a building, if and where possible, it is preferred the area is closed off and windows open for 24 hours before anyone comes into a complete deep and thorough disinfecting. For commercial spaces, this is naturally easier to do, wherein there's residential buildings, this can apply to offices, business centers, laundry rooms, etc. The rest of the common areas that cannot be closed should already have been cleaned numerous times per day, but a team of cleaners should be dispatched as well to complete an even more thorough and deep disinfecting of all spaces. The products and proper use. It is important that the proper products are used. All products used have to be approved and have the kill claims to the COVID-19 virus. We have switched quickly to the approved products and have stocked up the properties and trained the associates on proper use. Because the same products are not always available, it is important that the team is using the products or trained on proper use of each. It is extremely important to know that the spray and wipe does not do the job in this case. Each product has dwell time, which varies from 2 minutes, 3 minutes, 5 minutes, 10 minutes, or more, which means the surface, once sprayed, should remain wet for that period of time in order for the product to be effective. If you're having a hard time getting the products, you can always use household bleach, where you would mix 5 tablespoons or 1/3 of a cup of bleach per gallon of water, or 4 teaspoons of bleach per quart of water. Do not mix bleach with any other products, water and bleach only, and ensure that the bleach is not past its expiration date. Ensure that the space is properly ventilated and that the bleach solution is appropriate for surfaces you're cleaning. This is all very important because, as we all know, it is difficult to get all these products. So we're hoping not to get there and that none of you have to get there, but this is a simple way to get the job done. I will now pass the presentation on to Martin Calabar, who will go over some legal and insurance aspects of what we are reviewing today. Martin?
Thank you, and thank you to planned companies for having me here today. I know a lot of people on the line have been having all sorts of legal questions, insurance questions, employment questions throughout this pandemic that we're all facing, and so they wanted me to come here and talk about a few of those things, the first being the stay-at-home orders. If you could flip to the next slide, please, Nick. So I'm sure all of you know by now that a number of states have issued these stay-at-home orders. And what's most important is that you understand that each state has its own order that may say something different from the next even neighboring state. So it's very important that you handle all these questions about what does that mean, who can go to work, who's essential, who may not be essential under one order, but still permitted to work in a particular state. Make sure that you're speaking with your attorneys or your general counsel, or if you're a manager working with an association, their attorneys or general counsel, so you know what your order says. For example, in New Jersey, many people probably on the line who are from New Jersey know non-essential retail businesses are required to be closed. There are some other businesses, though, because retail deals with the sale of goods. there are some other businesses that are permitted to remain open. One of those, for example, would be a company like Planned Companies, who's doing janitorial, maintenance, security, concierge, that type of thing. If you could flip to the next slide, please, Nick. So again, this is a general list, and you got to focus on state to state. But for the most part, these are the types of businesses that are either going to be deemed essential or still allowed to operate. I think the ones towards the bottom are probably throughout most, if not all states, when you're talking about things that are essential to your daily life, like grocery stores, doctor's offices, gas stations, hardware stores, laundries, and pet stores. But as I said, there are other companies that are still allowed to stay open. A company like a Planned Services, a lot of the administration work that management companies do may need to be done from home, but some of that on-site work that could not take place from home, for example, in New Jersey, would be permitted, provided that the work from home was not possible and that was an essential operation to keep the business functioning. Next slide, please. And so if you have any questions about any of that, please feel free to use the Q&A section. Another topic that has really been coming up is employers and employees, and how do you deal with an employee who gets COVID-19 or has symptoms of COVID-19. So in New Jersey, and again, this is going to be state-specific legislation, so make sure you're checking your state's executive orders that they may have passed. But in New Jersey, for example, it's an employer, if he learns that an employee has COVID-19 or symptoms of it, and that person gets a doctor's note, the employer is not going to be able to fire that employee because they got that disease. The employer probably, though, does not need to pay that employee. However, the employee is probably going to be eligible for things like accrued sick leave, temporary disability, or FMLA, Family Medical Leave Act leave. Probably not going to be eligible for unemployment in that circumstance, though, because you are not losing your job technically. You are just staying out for those 2 weeks. However, there are some circumstances where you could be eligible for unemployment. If the employer voluntarily closes as a result of this, if the employer is forced to close, or if your hours are shortened due to slower business or lack of demand. There is obviously currently a federal national bill that is going to the House that should be approved pretty soon, but you also have state legislation dealing with unemployment that may apply to employees who are laid off as a result of their business having to close down. So with that, I will turn it over to Dino now, who's going to talk to you folks about security.
Thank you, Martin. And that is certainly some very interesting stuff, and I'm sure we'll have a lot of questions around your area. So thank you for being on with us today. Just want to, while there's a lot of focus on keeping places cleaned and the virus itself and how to deal with the virus, I just want everyone to remain vigilant when it comes to security and safety. During crime tends to be on the rise during troubling times like we're having now. People are losing their jobs. People are a little uneasy. We've seen in past circumstances that crime typically will rise. Keeping your staff safe from harm. A lot of you in your questions, and a lot of folks on other panels that I've spoken on are very concerned about their front desk staff and making sure that they are safe, keeping them healthy. I know we at Planned are very concerned about that, and we're taking precautions to do so. On the slide itself, next to that very cool security officer, you'll see a couple of pictures with some ideas to keep your staff safe. Having partitioned off areas, I heard in some supermarkets they're doing this now, where they're putting plastic between shoppers and cash register folks. Anything we can do, as Rob mentioned earlier, staffing can and is a challenge. We certainly want to keep folks who are making the effort to get out there, leaving their families home and behind. We certainly want to make an effort to keep them safe while at our buildings and secure. So anything we can do, I'm happy in Q&A if you want to share some of your ideas or some of the other things that we're doing. You want to encourage residents not to linger or hang out in the lobby. People are bored. They're looking for things to do. Residents will typically, when we're not going through a situation of a lockdown or asking people to stay home, they're coming down those times to talk to people at the front desk. Now they want to do it even more. Perhaps a memo or encourage residents not to come down. Locking down doors that perhaps were not locked down before. Making sure that we can control the points of entry to your buildings or your properties. We want to be able to know who's coming in, who's going out, when they're in. We want to make sure now more than ever that we are keeping the areas secure. And locking down and securing your supplies. During times like this, toilet paper is a commodity. Things that are in your building that you may have in storage areas, things that you didn't think you had to lock down before, now need to be locked down. These are supplies that people are looking for and things that people want during these times. So keeping those areas secure and making sure that you limit access will definitely help. So security, make sure it remains paramount. Let's not forget about it, all while keeping the safety of your staff in mind and keeping your building secure. It's what we're looking to continue, and hopefully this will be short-lived and we'll get back to normal. With that said, I'm looking forward to answering more of your questions during the Q&A below, and I'm going to pass it back to our moderator, Nick.
Okay, thanks, Dino. We have a number of resources available at our COVID-19 page located at plancompanies.com/COVID-19. Also, if you have any questions after this webinar, you can reach us on marketing@plancompanies.com. Also, I think I mentioned earlier, this meeting is being recorded and will be available on the Plan Companies COVID-19 page sometime probably next week. So with that, we'd like to start our Q&A session. And looks like we have a question for Martin. Martin, when do you think we can have our property do landscaping again?
Okay, so this is one of those questions that is state specific. And right now, for example, in New Jersey, you are still permitted to provide landscaping services. However, you need to follow the CDC guidelines for social distancing as well as sanitation. So making sure you're washing your hands and using hand sanitizer and those types of things. In New Jersey, you could do that. I believe in New York, you could as well. So you have to check your local state orders, but typically landscaping is something that is going to be permitted because it is something that's done, outdoors, similar to construction.
Okay. Question for Astrid. How frequently do you recommend that things like door keypads, elevators, and spaces, common areas should be cleaned to safely disinfect them?
Sure. As frequently as possible. I mean, with this whole thing, we're all learning how to live and new ways of doing things. Unfortunately, if an infected person is walking to the building and coughs on their hand, and with that hand they're opening the door, and it was 5 minutes after somebody cleaned it, now it's on there. So the best is as frequently as possible. There really is no every 2 hours or every 3 hours. So depending on the staff that you have allocated, this is a team effort. This is where the doorman in a building that has a doorman should be empowered to do that while wearing protective equipment and continuously wipe down the doors and door handles. Concierge would be able to chip in and help as well. The maintenance staff, so as frequently as possible.
Okay, thanks. And again, to the attendees, down at the bottom of your screen, there's a button for Q&A. You can tap that and then type your questions in. Another for Astrid, in the event of supply shortages like cleaning supplies, PPE, etc., are you guaranteed as a company some level of service? How would you prioritize?
Yes. So we are doing pretty good with stock right now. We have many people working on it. We're speaking to CEOs of companies, and it's not just one company. We have about 8 suppliers For example, we're having some personal protective equipment shipped from DC tomorrow, because that's the market that we were able to find them. We're having masks hopefully come in the next couple of weeks from Florida. So we're going to provide the products. The issue might be, and I hate to be a pessimist, I am an optimist always, but if this spreads the way they're all spreading, staff is going to be the biggest challenge. Healthy staff is going to be the biggest challenge. So to our business continuity plans and contingency plans, we're working with property managers, like most of you are on this call, to come up with what if scenarios and the worst case scenarios and how we're going to get the very essentials done. Our recruiting team has been working very hard in making sure that we have a bench, and we've partnered up with some other companies to help each other out. But to answer your question, we're doing all we can. Supplies should not be a problem. PPEs might be an issue somewhere later down the road. We don't know how long this is going to last, but we are doing all we can with every resource at our disposal to make this happen. We're having to overpay in most cases. Unfortunately, there are people out there that are taking advantage of the situation and are charging ridiculous amounts of money for PPEs. We're paying it because the health of our associates is very important, and you can't put a value on that. And I know I could get long-winded, but I hope I've answered your question.
Okay, great. This is for Dino. What is the best way to protect our staff from contracting COVID-19 when they're the ones working the most closely with the positive cases in our community?
Yeah, thank you, Nick. I think similar to what I was stating earlier, it's important to shelter your staff and keep them away from folks as much as possible. One of the other things for our front desk teams that we're doing it with a lot of our properties now is, rather than having residents come downstairs to retrieve packages, we are delivering it. We are adding an extra person to a lot of properties for that purpose, to have their packages delivered to their doors. I was asked, so I'll mention it. Well, how do you prevent someone from coming to the door and taking it? When you do that, we call ahead. So just like a food delivery you may have now or anything else, we're calling the resident ahead, say, hey, you have a package down here, just want you to let you know. I'm going to be leaving it at your door in a few moments. I will knock so you know it's been left. This way it's not left out in the hallways. Keeping the distance. Some properties we're putting a 6-foot rope. Some are using tape on the floors to show where don't pass this line. Everything you can think of, up to and including the glass that I mentioned, or the plastic I mentioned earlier. So Nick, I saw it was another question, so I'll dive right into, someone asked, where could we get those plexiglasses? And last I saw, they were on Amazon, but you couldn't have them delivered for up to 30 days now. So like supplies for just about anything else, it's a challenge getting stuff like this. And Amazon, even for regular things now, are up to 2 weeks to 30 days out. So any type of glass, any type of plastic, anything you can do, I'm sure people are starting to come up with more creative ideas. A gentleman I spoke to yesterday actually is building them. So I think keeping that distance will keep your staff safe, which is what we all want. We want continuity at our buildings. We want familiar faces. We want people who know how to operate our buildings and front desks and who are familiar with your protocols and everything. So keeping them safe is not only paramount to you, it's paramount to us as well. So thank you for that question.
And just jumping in, just think about your access protocols in general, like who you want to allow into the community during this time. And if you're going to put restrictions or limitations, what is best for the community? I know there's questions about on gates for active adult communities. There's a couple questions that I see some of our gates are asking, just to make sure that those entering the community, if they've been impacted by the virus, if they have it, if they had it, if they were exposed to it, well, some of these communities are asking to vet that and kindly ask them to, and alerting the residents to turn away. And Martin, from the legal standpoint, can jump in here, but I can understand why facilities want us to vet in certain instances for active adults for 55 and better. It makes sense. There are other trades that maybe don't need to go into your communities or properties at this time to reduce the statistical probability of spreading the virus. So just certain things to think about. And Martin, I don't know if there's anything that's ironclad or specific, but I know that's a big one that's on many people's minds of who goes in and out of a community.
Absolutely, yeah. And again, like many things, when it comes from a legal perspective, it is state specific. But for example, so New Jersey has just some general provisions in the Condominium Act where the association is responsible for maintenance, repair, replacement, sanitation of the common elements, right? And so we take that to mean, in conjunction with the governor's executive order, which is requiring people to stay at home, that an association absolutely could restrict guests and visitors from coming into the building, because that wouldn't be a permitted reason for somebody to leave their home in the first place. So if you wanted to put something in place, you could absolutely adopt rules and regulations. Your buildings could do that. If you, on Becker's COVID-19 page, the New Jersey version, we actually have a questionnaire that we recommend asking people. It's sort of a screening questionnaire. And if they answer yes to any of them, we obviously do not recommend that you let them in. One exception to this that I would say is, if you're having caretakers or medical professionals come to the property, if they're there for an emergency reason, let them through. If they're there on a regular or daily basis, they could absolutely be screened. If they're there just for general care, you can still screen them. And if they answer yes to any of those questions, you could deny them access. Another category of this would be the plumbers or electricians who are responding to emergency situations. Like everything else, case-by-case basis, but obviously if there's a plumbing leak, you got to get a plumber in there. You might take some other precautions and whatnot. But yeah, generally I would say definitely in New Jersey, you could restrict access to guests to the property.
Thank you.
Okay, great. We've got another question for Martin. What is the current best practice relative to the time when a person is diagnosed with COVID-19 and was last on the property to when we need to do a deep cleaning? 1, 2, 3 weeks. Also, what if the person was just exposed? What about a person who was just exposed?
Okay, so with respect to best practices, you'd want to follow the CDC guidelines, right? And the CDC guidelines are saying that anyone that is exposed to something like that, or if you had a diagnosed person come to your property, you want to self-quarantine for 2 weeks, right? So the same thought process should go through with respect to cleaning a property if you learn someone came in the last 2 weeks that had actually been diagnosed. The second part of that question is, what if the person was just exposed? I'm not sure exactly what the questioner is looking for in that regard, but I can tell you generally, if a management company learns that a resident in the building has been confirmed to have COVID-19, there's a couple of things you can do, but only if you have that from a reliable source. And reliable sources would be the resident themselves telling you they've been diagnosed, someone who lives with the resident, not in the building, but lives in their unit or in their residence with them, telling you they've been diagnosed, or a local, county, or state health official telling you they've been diagnosed. Outside of that, I don't think you have enough information to assume that they have been diagnosed positive. If you have information from one of those three sources, you are permitted to tell residents in the building that someone has COVID-19. You can't, without that person's permission, though, identify who they are, what unit they live in, or any other personal information. Though you should contact that person and do your best that you can to backtrack who have they come into contact with in the last 14 days in the building, particularly staff. The other thing an association and management company is going to want to do is let a planned companies know, hey, by the way, there is a resident. We don't know if they came into contact with any of your staff directly, but then you might have some decisions that need to be made amongst the management company and amongst your vendors, and then obviously with the board and what they're going to tell the residents. So if that happens, first and foremost, this is just general information. Go to your legal counsel because it is so specific.
Great. Thanks, Martin. Dino, I think you had an update for us.
I did. I just wanted to mention that one of our questioners was nice enough to do some research and find some of the panels that I spoke about earlier. So what we'll do is we will post it out to everyone who's on the call here so that you can find it. And thank you very much to the person who shared that information with us. We'll get that out to the team.
We're also getting questions about the supplies and equipment that we're procuring, about where to get these gloves, masks, disinfectants, and we can certainly give you the names and contacts that we use. We obviously have significant purchasing power, but as I mentioned in the challenge discussion, that we are, striving to get everything as well in. But we could give you the names and contacts that we're using, and a number of our contacts are reaching out to us, and by the day, sometimes we get pleasantly surprised that a shipment's coming in, like Astrid mentioned, of gloves soon or masks soon, and then other things take a little bit longer. So we can give you that as well if you want to separately reach out, or we could put that maybe out into something that's shared for the group.
Rob, just to add to that, if you don't mind, many of the suppliers are not opening up new accounts. So we could certainly provide that information, but at times of crisis, everybody wants this, and they are doing the best they can to provide the products to the people they already have established partnerships with and relationships with. So we could do that, but it is difficult. You might want to just go to whoever the supplier was for the property and make that happen, but you could reach out to us. We'll be more than happy to help out in any way, shape, or form. While not being able to guarantee anything, we'll certainly do our best to help out. Like we had a shipment for somebody that called from North Carolina that was in desperate need of some paper products and some wipes, and we managed to get them from a local person there, and they were shipped. And so we're doing our part in every which way we can.
Thank you.
Right. All right, question for Astrid. What is electrostatic disinfecting? How is it conducted? And is it more important to perform on a regular basis?
Sure. So electrostatic spray is an electrically charged, allowing the appropriate sanitizers, mold preventatives, and disinfectants to wrap around and evenly coat all types of surfaces for a more complete clean. As the chemicals exit the electrostatic sprayers, it is given a positive electrical charge. The droplets then become attracted to all negative surfaces, covering the visible areas, underside and backside with a sanitizing agent. So, while daily and regular disinfecting is done by the cleaning staff, it can only help to use the electrostatic sprayers as the disinfecting is now done in harder to reach areas.
Okay, great. Thank you. Question for Martin. On a legal standpoint, can an association ban nannies, dog walkers, and chefs from working at our properties during this time?
I think he kind of answered that one before.
Yeah, that was sort of lumped in with before. And if you want to get specific to those three, yes, because they're guests of the property, you could make an outright decision that you're going to ban all of those categories of people.
I think a good one that Sal had put on is, so like in terms of hearing that someone's infected, and what's the time period of when you hear it, of disinfecting or cleaning the areas in the building. And Astrid, I know that you're going to answer it, but you had mentioned that, you could do a deep cleaning and then, something can happen, right, 5 minutes later, an hour later, but you want to just tackle that one in terms of when we're alerted to someone being impacted by this, what's the right kind of steps for
this? So sure. So the comment about the 24 hours is for areas that you could close off to the public, just to clarify, because the question is, What if the person infected was not in the space in the last 24 hours? Do you still need to wait the 24 hours to clean it, or is it just from the last time they were there? So that the focus on the 24-hour closing of the space is really for the safety of the people that are coming in to do the cleaning. Less chances of being exposed to it. In some areas and instances, you certainly can do that. But like I mentioned before during the presentation, that you don't always have that luxury. As soon as we're notified, the partners that you have cleaning and the companies that you have working with you should be notified as soon as you're notified that somebody, has a confirmed case of infected. The cleaning should happen right after that. I can't stress it enough that you can't clean enough. From our, personal lives to everything we're doing out there for you and the clients that we have, you continuously need to do this stuff. It is impossible almost to keep it away, but you have to continuously do it, disinfect it, wipe it, and communicate with everybody once you're made aware that somebody was confirmed that they have it, so you could backtrack and see where they went, where they were, who were they in contact with, and we could work, this thing backwards.
Good.
Okay. This one looks like for Rob. When tests become more readily available, will staff be periodically tested to confirm not affected by virus? The custodial team frequents more spaces throughout the building than most individuals in the building.
Yeah, the custodial team does, in fact, probably more than anyone. They're going through the property, they're going through the complex. First of all, I hope tests become readily available for everybody who feels that they have a fever and that it's worse than just a common cold. So one, I think they need to get the tests available for this country. As time passes, and I too, like Astrid mentioned, I'm very half full, optimistic. But I think that this is going to be this is a very tough time, and it could be tough for a while. I am very open-minded as time moves on to taking all the steps, because I even think for our employees, they'd like to know that they're healthy and that the buildings that the working conditions they're in are being treated the right way with the right supplies and the right support. So I'm not ruling anything off the table. If that's something that is readily available and can be done, and it's going to put a peace of mind and create a safer work environment, I'm not closed-minded to it at all. And then I see from the same question, I think was that Nick, was that Thomas who asked that? Because I see another
Yes,
one.
Rob. Yes.
All right. So will additional costs incurred by plan for supplies and hourly rates be affected in the invoices or solely assumed? So Astrid mentioned, in terms of, we're trying not to use this time as anything other than to get through it, and we're all together. And I see people out there doing crazy things. The labor market part, we're working our best to address all the staffing needs. We have recruitment looking to get, sadly, individuals who've been impacted in restaurants and hospitality who are looking for work to get on the bench, as well as the fact that we have a large commercial and corporate vertical that is suspending and closing down buildings right now in areas that we service and trying to deploy labor to other buildings. In terms of supplies, I'll let Astrid answer, but one of the things we thought was very important was to switch a lot of the product or most of the product to the right products and not, have the clients incur an additional cost. So I'll let you jump on this too, but
Sure.
We've been very sensitive to this, but it's still, it's a very tough situation for all of us, I think.
So thank you, Rob. We as a company decided to do our part. While those products are more expensive than what we have used in the past or thus far, and they're certainly harder to get now, and they're even more expensive now because the demand is higher. For the time being, we're not charging anybody. It was our commitment to keep the property safe and to do all we can. There is a lot of burden put on anybody, and we felt that it's the right thing to do. As far as and by the way, we would never just blatantly increase our invoices and put something on the invoice without having a conversation or approval from you. As far as the hourly rate, because the question is, will additional costs incurred by plan for supplies and hourly rates be reflected in the invoice or solely assumed by plan? So I answered the supplied one. As far as the labor, it is becoming harder for us, just being honest, to keep people going to work every day when they're exposed to everything that's going on out there. We're having individual conversations with property managers and people that we have contracts with and asking them if there is a possibility where they would approve an additional wage or additional amount so we can only pass on to our associates. We do not want to make a penny more than what we're already making. We're happy with the deals that we've made. It is difficult for us to pay them more than what we already contracted for in many cases because this business is a tight margin business, as many of you know. But you know, we're speaking to property managers and partnering up for, and some boards have been very open and saying, yes, pay them $2 more. What would our charge be? And we're doing it case by case, but never a blanket approach where you're being hit with additional charges without you knowing. We would love to partner with you now and do something for our associates because they are the front line, just like the nurses and the doctors are. They are exposed more than any of us out there. So I hope I answered that.
You did.
That's great. Question for Martin. What is the protocol for employees who have to travel to job sites with multiple passengers in a vehicle that may violate social distancing?
Yeah, I mean, as so far as that is concerned, I would stay away from having multiple people in a single vehicle. If they have their own vehicle, let them drive their own vehicle to report to work. You could certainly stay a couple feet apart, 2 people in a vehicle, one in the front, one in the back, one on the passenger side. But the general practice should be at all times to try to, adhere to social distancing policies. If the people live together or they are related or have a close personal relationship, I think they could be in the same vehicle. But generally, you're going to want to do your best to limit that to the bare minimum.
Okay. Another one, Martin, for commercial properties who are you seeing bearing the cost for the deep clean after notice of infected persons or exposed persons?
So the reason I wanted to answer this one is not because I have some particular knowledge as someone at Plan may have with respect to who's fronting up the original cost. That'll probably be Astrid or somebody else that would have to answer that part of it. But there's an interesting potential for an insurance claim to be made here, depending on the type of coverage that you have. And this would be for community associations as well as commercial properties. You have to see what type of coverage you have. But what I've, in talking to a couple insurance professionals, have learned is that you should at least put a claim in if you know that the person was actually infected. Now, you might have to get some documentation to that effect, but it's better to put your carrier on notice sooner rather than later because it's possible you could have coverage for that. And there's probably going to be an influx of these claims. So my recommendation would be don't delay. Get the claim in. It doesn't hurt to at least put it in, especially if the costs are significant. And if anyone else at Plan wants to add with respect to kind of having to bear the upfront costs, you could certainly do so.
Yeah, absolutely. I mean, once there is a confirmed case, like we're doing within our contractual hours for commercial-based businesses, there is no additional cost for daily cleaning. A lot of the offices are now closed. We are partnering up with companies and keeping the staff on for regular maintenance, so they're going to be able to focus on continuous disinfecting and deep cleaning. Granted, we have less people in a building, there's less garbage, less dust, less areas to clean. We're keeping those hours and allocating it to disinfecting the property. But should there be a confirmed case where people need to come in, our response team comes in, we're fully protected with the right PPEs, there unfortunately will have to be an additional charge because it's not being done by the associates that are slated to be at that property.
Okay, another question for Astrid. Can you please furnish us with the MSDS on the new agents being used for cleaning?
Sure. If that is a specific property, we could. We will have to only say that because we need to know at which properties. By the way, every product that we use and we deliver on properties should be accompanied by the MSDS sheets. So if we provide services for you, that should already be on site. If we do not provide services for you, we would need to know what product is it that you're using with your in-house staff or your other vendors, and we'll be more than happy to get that over to you ASAP.
Okay. All right, great. Another one for Astrid. What kind of cross-training are we looking at between custodial and concierge staff in case the concierge staff is affected?
We have not done that yet, only because it is a different skill set. And as many of you know, a majority of our custodial staff were just in the industry. It's an industry thing, not a plan thing. Might not be as proficient in using the computers for logging on packages and announcing guests, and might not be fluent in English. We are not exploring that just yet. At the end of the day, if and when we run out of healthy people, that's going to be one of the last resorts that we go to have a person there. But for now, we have enough floaters that are cross-trained. We have enough of a bench of people that are coming in to substitute for those front desk associates. We have field managers and supervisors that know your properties, that can easily train them on the site-specific deals. So that is going to be as one of those last resort, but nothing like that has been done in a global sense yet.
Okay. And a question for Martin, I guess looking for a definition of what stay-at-home means.
Yeah, so it means exactly what it sounds like. Stay at home unless you are out of your home for a permitted exception under your state's order. Some general examples of this would be obtaining goods or services from essential retail businesses that are permitted to be open. Think your supermarket. If you're getting takeout food, if you're seeking medical attention or assistance from law enforcement or emergency services. If you are reporting to or performing your job, assuming you have a job that you're permitted to report to. And then other things like walking and getting some exercise outside. A number of areas have shut down, though, and many communities have also shut down recreational facilities. But you can still go out in your neighborhood and go for a walk, but, adhere to those social distancing policies of staying 6 feet apart and sanitation of, washing your hands and using hand sanitizer and that type of thing. It's not a shelter in place order, right? But stay at home means stay at home, do just that. That's what is ultimately going to result in, and I'm sure everyone's heard this, flattening the curve. And that's why these orders are being entered. So to the extent you're able, yes, do it, adhere to it. And if you have a job where you're permitted and, you are permitted to go outside and you're permitted to report to your job, then do so, because that's important too. And the services that companies like Planned are providing to everyone are essential because they're help keeping us safe. So, if you work in an industry like that, obviously you need to get to your job. So it's okay to go.
Okay, thanks.
Hey, Martin, I'm not sure. I'm sorry, Dino, go ahead.
No, I was just going to ask that for the sake of time, I see we're closing in on an hour here. We have a few questions left, but we want to give an opportunity for maybe like 5 more minutes for anyone to submit new questions if you're thinking of one, so that we can kind of get to all of them, and then we'll put a close to the questions.
And if we don't, I think we got your emails when you jumped in, and we're happy to answer any and all questions that you have. We did get to almost over like 20 of them, which is great, and very engaged group. So thank you. But if you have a question and we don't get to it, just offline when Nick showed you the email addresses for Martin from the legal standpoint and for Planned, we're happy to point you in the right direction or try to address it. There was a question, Martin, that I see from my friend David in the Mid-Atlantic here. Most claims will likely be denied, but look for a program similar to TRIA, Terrorism Coverage Backstop, from the government. Do you know anything about insurance type of coverages that some of the team here? Is that just totally a different?
Yeah, no, that's a little bit of what I was talking about before. Is you might have coverage in most circumstances. You're probably not, but if you have, you might have a specific exclusion for disinfectant expenses. A lot of them do, but it all depends on the policy language. And some may provide coverage for disinfectant and decontamination expenses. If they do, obviously, then that's great language. And there may be some other arguments that could be made for coverage. And that's why I said it doesn't hurt to just put the claim in if you have to, go out and spend significantly more than your deductible on a cleaning because you had someone who tested positive.
Got it.
Okay. Martin, who determines what and who are essential?
So that's going to be state to state, and that's going to be what the governor's order in that state says as to what and who are essential. In New Jersey, essential really applies to retail businesses, meaning the sale of goods. So that if you are not specifically mentioned in the order and you are a retail business selling goods as being essential, then you are non-essential. However, there are a number of other businesses out there besides retail businesses, and New Jersey's order gives an example of some that cannot, all other businesses, what it says is are required to work from home, but it gives an example, and it's not a be-all end-all list. So if you're not on that list, consult with legal counsel to see. But they give an example of things that you could not possibly ever do from home, and therefore they are allowed to report, obvious ones: law enforcement, firefighters, first responders, right? Cashiers and store clerks come into play there. Construction workers, utility workers, repair workers, warehouse workers, janitorial custodial staff, certain administrative staff. If they're, you're required to keep it to a minimum, absolute minimum amount of employees it would take to do those tasks. So, look, if you can work from home, work from home. If you have questions about whether or not you are permitted to, certainly look at your local state's orders.
Great, thanks. We have time for one more question. The other questions that were asked, we'll follow up with you via email. This is for Astrid. If there's a mandatory lockdown, does that include essential businesses and sanitation?
Wait, if there is, I'm trying to see the question here. Sorry.
I may have asked the wrong question.
Astrid, I could take that one. Martin, I can take that one. So again, and I see that's from Wayne. Wayne, if it all depends what the governor's order says, right? Right now, there is no shelter-in-place order. I know when it first came out, the news reported, states are entering these shelter-in-place orders because that's something that was familiar to people in times of, a potential nuclear situation. Was you have to stay home. You can't go out. It's that emergent for everyone's best, protection and safety. No state has indicated that they would be willing to go that far for something related to COVID-19, at least not yet. Of course, you will certainly learn and know if they do enter that order. It'll be all over the news. You'll hear about it, and you'll know who, if anyone, could still stay open. And in that case, it might just be, any emergency businesses. But I hate to, we don't want to be alarmist. There is, obviously this is an important topic, but, no one knows, how long this will stay in place or what the next steps might be. But I can tell you the orders that are in place now are not mandatory lockdown or shelter in place orders.
Great, thank you. Well, that was our last question. So thank you everyone who stayed on. We appreciate your time. We'll be following up with you. This webinar will be recorded and we'll make that available to you. So thanks for joining.
Thank you.
Have a great day.
Thanks, Nick. Thanks everybody. It was a great webinar.
Thank you for having me, everyone.
Everyone be healthy and safe. Thank you so much.
Take care now. Bye-bye.
Bye. Bye-bye.